I'd like to call to order this meeting of the First Five Sacramento Commission for Monday, May 2nd, 2022. Madam Clerk, will you please call the roll and establish a quorum?
Chair Cerna.
Here.
Commissioner Sierringer. It's not here. Commissioner Fernandez y Garcia. Commissioner Gordon.
Here.
Commissioner Casirier.
Here.
Commissioner Wagstaff.
Here.
Commissioner Wirtz.
Here.
Okay, Commissioner Kennedy. Commissioner Hassett.
Here.
Commissioner Turner Johnson. Commissioner Evans. Commissioner Cathari. And Commissioner Moak. Okay, we have a quorum.
Great, thank you. Will you please rise and join me in the Pledge of Allegiance?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so I want to welcome everyone to today's commission meeting. This is the first in-person convening of this commission, I think, in over 2 years.
Correct.
So it is somewhat of a momentous occasion to see our colleagues and staff in person. I think it's yet another indication that we're inching towards normalcy here. And really is satisfying to, again, be back where we should be here in chambers, accessible to the public in person. And I'm very glad as the chair of this commission that we're able to be here today. We do have, as most can see, a pretty thin collection of commissioners today. We are right at quorum, I believe. And we do have a full agenda today. We're going to do our best to manage it. I will do my best as chair to do so. So with that, Madam Clerk, do you have any announcements you'd like to make?
Replay statement, please. This meeting of the First Five Sacramento Commission is cablecast live on Metro 14 Cable, the local government affairs channel on Comcast, Consolidated Communications, and AT&T Uverse cable systems. This meeting is closed captioned and live streamed at metro14live.saccounty.gov. Today's meeting will be repeated Saturday, May 7th at 2 p.m. on Channel 14. This meeting can also be viewed at youtube.com/metrocable14.
All right, very good. Okay. As I mentioned, we do have a full agenda, so we'll get right to business. First item on our agenda today is consent matters. And this is the approval of the March 7th, 2022 draft action summary. Does any commissioner wish to make changes or have any comment? If not, I'd entertain a motion.
Move approval. Second.
Been moved by Commissioner Wagstaff, second by Commissioner Gordon. Madam Clerk, I assume we don't have any members of the public that want to address the commission on this matter?
No, sir.
Okay, with that, we have a motion and a second. Please vote.
Motion passes.
Motion passes. Okay, very good. Thank you. All right, we're on to separate matters. Our second item for today's agenda is recognition of Commissioner Wagstaff.
Thank you. I think many of you know that Commissioner Wagstaff is going to retire, and so this is his final meeting of the commission. So I had to take this opportunity to just say a few words in recognition of Bruce. He has just been a wonderful boss. He's calm. He provides good advice, good guidance, and it's just.
Are you talking about me?
Yes.
Okay.
He is so calm. Like I can always bring Bruce bad news, and he just takes it in. He problem solves. He never blames, never berates. Just always helps figure it out. And as a boss, like, that's something that I so appreciate. I don't know if you guys know that he sort of has a special role here too, because I believe this is his second retirement from this commission. So, and he also was a commissioner in Santa Clara County, so he's got 3 commissioners' spaces that he's fulfilled. So 8 years here, and I don't know how many in Santa Clara, but that's a lot of years as a commissioner. And I have a resolution, which I won't read it all off to you. All I wanted to say is what I've appreciated from you up on the dais is the questions that you ask and the way you help us think through everything from evaluation to program delivery, and you've made us a stronger commission staff by asking those questions. So thank you very much.
Thank you, Julie. Thank you very much. Thank you, Julie. That's very nice. Let me just say a couple words. We have a very busy agenda, but you're right. I've had the privilege of serving on this commission twice, which corresponds to the 2 times I've had this job in the county, and also with respect to First 5 Santa Clara County. So I've seen firsthand the contribution that these commissions make, both here and elsewhere, to the young children in our communities. And I remember very clearly when Prop 10 passed. I was at the state level in those days, and some colleagues / friends ended up being some of the first staffers for the first state First 5 commission, and it was clearly a big deal when that passed. All in the Family was still on TV, so Rob Reiner was only known by that unfortunate nickname that he used to have on that show. But the question was whether or not the potential of the initiative could actually be achieved in those days. When you think about it, it was a really big deal. And it seemed like a very tall order at the time. But I think everybody in this commission has shown that it absolutely could be achieved. And so you've made a huge difference for these kids. I want to thank you all for your service to our county. And I would just say keep up the fight for our young people, and I wish you the very best. So thank you, Julie.
Thank you, Bruce.
Oh, my goodness.
There you go.
Thank
Just another one for your wall.
Thank you.
Bruce, do you have a first? Do you have a first retirement wall and a second retirement wall?
I just want to also dispel rumors that this is only the second time that I've retired. There is rumors that this is the 3rd or 4th.
No.
It's only the 2nd. And just so you know, thank you again, Julie. Thank you very much.
Yeah.
Thank you, Julie. Any other commissioners want to make any statements? Yes, Commissioner Wertz.
If I could, Bruce, I've really enjoyed sitting next to you or close to you on the commission here, and I'm always pleased and sort of worried that because you weren't on the evaluation committee, you always bring these evaluation questions to the commission. And so I've always appreciated that and have always thought about your concerns about making sure that we are accountable and that we're measuring things as best we can. So I just wanted to thank you for keeping us on our toes as well.
Thank you. Done a great job. Thank you.
Commissioner Gordon.
And Bruce, just as one of your constituent agencies, so to speak, I just want to say thank you, particularly for the last several years. One of your colleagues sitting right beside me and you, we could not have made it through in the schools these past couple of years without your good advice, your collaboration, and most of all, your accessibility and availability. It's meant a lot, and the quality of our relationship has taken us a long way and will continue to do so, and you've had a lot to do with creating that.
Thanks,
so thank you, and all the best.
Thanks, Dave. Appreciate it.
Dr. Kasiri.
I just wanted to say that I've known you since I started in this position. And
I believe I hired you, if I'm not mistaken.
You did.
Yeah.
You did. So thank you for that.
You think?
And it's been a pleasure working with you. It's and I know these past 2 years have been tough. I'm glad that you're leaving at a time when hopefully COVID is being beat back, and I'm hoping that you will have many happy days enjoying your retirement.
Thank you.
And wanted to ask you, since you said this is only your second retirement, is there going to be a third?
No, that's pretty much my final one. pretty much my, and I would say too to the group, I was just saying to Commissioner Wirtz, don't fool yourself, this virus is still out there. Please be careful. We have an outbreak in our executive floor upstairs. Many people are out sick, so just please be mindful of that. It's still out there, and it's no fun to get, believe me, so.
Thank you for mentioning that.
Yeah.
All right, great. Thank you, Bruce, for your service to this commission and to this county. All right, we are on to our, I assume, Madam Clerk, we don't have any public speakers on Bruce's recognition?
Please.
Okay, all right, we're on to item 3 on our agenda. This is the public's opportunity to address the commission on any item that is not on our published agenda. I don't see anyone approaching the podium, nor do I have any speaker slips in possession, so I assume we do not, and therefore we will move on to item 4, which is the Executive Director's Report.
Great. Thank you all. Just a few items to highlight. I'll start with Advocacy Day, which was it might have only been last week, feels like a long time ago. We had more than 100 executive directors and staff and commissioners participated in the virtual Advocacy Day, and 49 of our 58 counties had a presence virtually, which is really great. We not only talked about things that the association as a whole is putting forward, but also things that were sort of near and dear to us with our legislative reps. Primarily, we focused on Medi-Cal continuous coverage, childcare investments, and home visiting expansion, as well as infant and child early mental health. I put a little blurb in your executive director's report around maternal mental health. I don't often take the time to talk about it, but we have some wonderful things happening with the collaborative. You may recall that we spearheaded the collaborative back in 2018. We played a role in staffing it, and we provided technical assistance to a new campaign called Be Mom Aware, and it is a campaign around helping connect women to services for PMADs, perinatal mood and anxiety disorders. We also are a proctor for a graduate school intern in public health who's been working primarily with the Maternal Mental Health Collaborative. And then I'll jump to a new commissioner update. So Commissioner Cossack's last meeting was in December, and we have been doing a little bit of recruitment. We have 2 applications, I'm happy to say. Both of them are Community Connections grantees. So we could have a parent joining us. Both are amazing women, and it's with the chiefs of staff now from the supervisors' offices to interview and make a recommendation. So I believe we will have a new commissioner beginning in August, which would be great because then we're going to dive into some more strategic planning in August. With the state budget, my only update on that is that California's new child care union successfully negotiated stipends for providers, which is a pretty big deal, actually. They'll receive a one-time stipend this fiscal year, and then they will receive monthly payments for the next year moving onward. So again, we do have a child care shortage. We had many child care sites closed down during COVID, so we really think that this will go a long way to bringing in new businesses. And then finally, shortly after your packet was posted, we got news that the governor appointed a new chair to First Five California. So that was Nadine Burke-Harris, and she is being replaced with Giannina Perez, who is the governor's former senior policy advisor for early childhood, and she has over 18 years of experience in advocacy and government, and was selected for the appointment after working closely with the governor and with the prior chair. So she's going to replace Nadine Burke-Harris, and next week is their first meeting with her as chair, so that'll be exciting. That concludes my report.
Very good, thank you. Any questions for our executive director? Don't see any. Madam Clerk, we don't have anyone in the queue to address the executive director's report?
No, sir, we do not.
Okay, very good. Thank you.
Yes.
All right, very good. We are on to item 5 on our agenda. This is the advisory committee update for March 30th and April 8th, 2022.
Perfect. So I have, I'm going to do a few things on this one. We have an update and then a recognition and a couple of appointments to make. So we did meet on April 8th, and we kicked off the meeting with a recognition of our longtime chair, Robert Silva. And I've asked Bob to join us today to come up to the podium so that we can acknowledge him for his work on the committee. So come on up, Bob.
That was a cue.
Yeah, that is your cue. Wow. I know. I'll speak in that one. You take that one. I think.
Sure.
Are we on? Okay. So I've already read this to him once, so maybe I won't read the whole thing today. But Bob has been on the advisory committee for 12 years, and he's been our chair for the last 7 years. So it's a huge commitment that he's made to this agency and to the children and families that we serve. He has endless enthusiasm for what he does. He is truly like the most inclusive and engaging chair that I could ever ask for, and he has this ability just to make all of our members feel very valued and included in the work that we do, and I appreciate that so much. Bob is still going to be at SETA, but working in a different area that doesn't allow him the opportunity to participate. Otherwise, I think we may never get rid of him.
Mm-hmm.
No, yeah.
We always got creative. Let's put it that way.
Yeah, yeah. But I just wanted to say that we truly appreciate what you have done for us. We will miss you more than words can say, and just wanted to say thank you so much and give you that and have you the opportunity to say a few words.
Is it? Okay. Let me just say this. Number one, wow, 7 years already at just, when she said that, it just didn't seem like that. And I think this has always been a labor of love for me. It's never been something that's I had to labor to do. It was always something I look forward to. I've always devoted my life to children and families, and I thought this was a perfect fit for that. I want to say first thank you to Jolie. Thank you for that. It was very nice to hear, but you were part of that. Her professionalism and her compassion for what she did, it was very engaging. And you always felt like you walked out of a meeting feeling like you accomplished something. It wasn't a namesake. We always felt like we left something, we were doing something. So for that, thank you very much. To the staff, all I can say is passion. Okay, every time we're in there is a smile on their faces, and they were always engaging in the whole process. You know, my dad always told me something. He said, son, do something you love, and you never work. So to the first 5 staff, you guys haven't worked in a long time, okay? So thank you for that. And last but not least, to the commission. I've known some of you. I've worked in various capacities with you in one way or another. And all I can say is I have the utmost respect for you, not only for what you're doing, but for who you are in general. So thank you for letting me be part of this. And let me just say this, if I can ever be of service to you in some way, please let me know. I think I've told Phil a few times I'd work on his campaign, right? So still holding you to that one. So anyway, thank you again, and I appreciate the opportunity.
Great. Thank you, Bob.
Okay, Bob did want to get a picture, if that's okay.
Yes, please. And while you're doing that, I'll just add some remarks and see if my colleagues want to join in. But
Okay, do you want to on what side do you want to
I just want to say to Bob, thank you, first and foremost, for your service and your thoughtfulness, for your time that you've put into helping this commission. I oftentimes think that by the time we have decisions to be made up here, it's with the great benefit of having a very dedicated and committed advisory body really get in the weeds as they should. That's kind of the purpose of having kind of the committee structure that we do. And you've been a tremendous leader in that regard, and always here with your reports. Your enthusiasm for what you do is, I think, very apparent to all of us. But again, appreciate what you've done, and I look forward to working with you in your new capacity, and probably will be taking you up on the offer to help us on occasion, because I think your institutional memory is very valued, and certainly as you advise this commission for years now, something that we should be taking every advantage of if it's still available. So look forward to that. Any other commissioners? Great. Thank you, Bob.
Thank you.
Okay.
That's perfect, but we can't see our chair.
It's all right. You don't need to see the chair.
We should go right here. Empty space.
Perfect. All right. Thank you.
Great.
Thanks, Bob.
Thanks again.
Thank you.
I believe we still have more underneath this agenda item, correct?
I do have just a couple of things.
Okay.
Just the update from the last meeting is that advisory committee members got to meet Commissioner Hassett, who spoke with them, introduced herself, entertained some questions, and hung out for a little while. And then we debriefed our joint ready meeting with the advisory committee and the SOS committee. That was pretty cool, I have to say. We got to dig a little bit deeper into the assessment that we all took back in December and sort of make some next step plans based on our Ready Action Plan. You'll hear a little bit more about that when we jump into strategic planning items later on in the agenda. And then finally, I am pleased to bring forward two considerations for joining the advisory committee. Tanya Morgan is being recommended to sit in our Children with Special Needs seat, and Alexandria Page is being recommended to rejoin in the parents' seat. She was in that seat previously and took a year respite, and is coming back to that seat. So we would need approval for both of those, and then their first meetings would be in June.
Very good. Does that conclude your report?
It does.
Okay, we do have an item in front of us that requires a vote. Is there a motion for the two appointments?
I so move that we accept both appointments.
Okay, it's been moved by Commissioner Wirtz. Is there a second?
Second.
Second by Commissioner Kasiri. Madam Clerk, we do not have any public testimony on the appointments.
No, sir.
Okay, if there are no further questions or comments by commissioners, please vote. No. Well, no. Sorry. I just saw it in front of you. There we go.
Thank you. Motion passes.
Very good. Thank you. All right. We are on to item 6 on our agenda. This is the Evaluation Committee update from March 21st and April 18th, 2022.
Thank you, Chair Cerna. We have had 2 meetings since the last commission meeting on March 21st and April 18th. The March 21st meeting discussed ongoing staff and ASR efforts to improve Persimmon database, our primary data collection tool, and referral portal options, the Persimmon and Unite Us, as well as new plans for the disparity dashboards, cross-systems review of racial disparities. But the bulk of the meeting was spent with a thorough review and discussion of the draft Birth and Beyond annual report for fiscal year 2021. We received several comments from the committee members in advance and also followed up the meeting with further comments as well, primarily around the 3-year analysis of the Child Protective Services outcomes, 0 to 17 section, The final report has now been sent off to graphics to be finalized for presentation to the commission in August, if that's. Then the April meeting was our first hybrid in-person Zoom meeting, which I think we helped work out some of the bugs for the process. We learned about the evaluation component for the new Building Strong Families program, which we're going to hear more about shortly. And in addition, efforts around proximity data collection improvement. We've had less than ideal responses with the post-family information forms, partly because of the COVID epidemic and its consequences. There are efforts now to work on that, as well as further development on the data dashboards. I always forget, Tableau, and then potentially the disparities dashboard. Again, however, the focus of the meeting, the primary focus was on the review of the SOS committee's evaluation plan, which we're also going to hear more from about today. But we were focusing in part on the community trends report component of that. So with that, that concludes my evaluation report, and certainly can answer questions if there are any, and thank you.
Great, thank you, Commissioner Wertz. Any questions for our evaluation committee? Seeing none. Madam Clerk, do we have any members of the public signed up to speak?
No, sir.
All right, very good. Thank you. We are on to our Financial Planning Committee update for April 21st, 2022.
All right, that would be me. So the Financial Planning Committee met on April 21st. We had quorum. Staff updated us on the effects of the state's new database system to check for Medi-Cal eligibility. And prior to the new system called Move It, MAA claims typically had around a 75% client eligibility, and with Move It, client eligibility is down to 60%. Staff is working with local government agency to improve this number by increasing submission deadlines and allowing for corrections and resubmissions. We reviewed and approved forecasts of Proposition 10 revenues, and these funds make up over 90% of the resources available in our strategic plan. We also approved assumptions for staff to use for the potential impacts of a statewide flavored tobacco ban. And Eric did a great analysis and gave us 3 different scenarios to look at and made various assumptions. Staff will use these revenue forecasts and flavor ban assumptions in the 10-year financial plan, and we went kind of middle conservative on that because we just don't really know what the effect is going to be. Staff also presented the fiscal year 22-23 recommended budget and 10-year financial plan, and we approved that. The item requests $20 million in budget allocations and includes new revenues from the American Rescue Plan Act, a reduction to CalWORKS equivalent to the amount of the funds that were not used, and an adjustment to increase Prop 10 revenues based on the new forecasts. We approved all of that, and the item is on the agenda today for consideration. And finally, the Commission financial statements for the third quarter were reviewed and were in line with budget expectations. This concludes my report.
Very good. Thank you, Commissioner Hassett. Any questions for Beth?
I've got to say, we don't ever talk about cliffs anymore. It's a great life on the Financial Planning Commission, or Planning
Knock on wood.
Committee.
Madam Clerk, do we have any members of the public signed up to speak on this item?
No, we do not.
All right, very good. Thank you again. A little house cleaning before we, housekeeping, not cleaning. Housekeeping before we move on. It's my understanding that the speaker that we are expecting for item 10 is not here or here?
Not here yet.
Okay.
Not here yet.
So as we progress through the balance of the agenda, I think what we'll do is just hold item 10 until we have confirmation that he or she is prepared to address the commission. So with that, we'll move on to item 9. This is the public hearing for approval of recommended budget for fiscal year 22-23 and 10-year financial plan.
Chair Cerna, you may have missed item number 8, which was
Oh,
the SOS committee update.
Thank you for that. So we do have a Systems Optimization and Sustainability Committee update for their meeting of April 19th, 2022.
And Commissioner Eric Fernandez
And that's
Garcia
me.
will take it.
And apologies for my tardiness today.
No worries.
So the SOS committee held our regularly scheduled meeting on April 19th. That day was Advocacy Day, first 5 Advocacy Days, so our meeting was abbreviated. And during that time, we discussed the evaluation of SOS activities and held a debriefing similar to the other committee about the joint SOS and advisory committee meeting regarding our Ready Action Plan. Our next meeting will be June 21st, 2022.
Very good.
Thank you.
All right, any questions about the SOS committee update? Don't see any. Madam Clerk, do we have any members of the public signed up to speak?
No, we do not.
All right, very good. Thank you, Eric. All right, now we are on to item 9, and this is, again, a public hearing, consideration of a recommended budget for fiscal year 22-23 and our 10-year financial plan.
Okay, thank you. Good afternoon, ladies and gentlemen of the commission. My name is Eric Harold, Chief of Administration for First 5 Sacramento. I'll start off by saying that the budget we are considering today is the fiscal year 22-23 recommended budget, and it's the second year of the 2021 strategic plan. This budget conforms to the approved strategic plan, allocating $14.9 million in expenditures, and is adjusted by other actions taken by the commission. This version of the budget assumes approval of the CalWORKS home visiting program, as well as the American Rescue Plan Act funds, also known as ARPA. The strategic plan that is in place, along with the implementation plan, which gives specific spending information to the strategic plan, really makes the budget process a prescriptive process. With all that, I'll go ahead and ask that we review attachment 1, the budget highlights. Okay, at the top you can see that we have $20 million in expenditures. 5.2% of this is for administrative expenses. 2% is for evaluation, as well as 92.8% for program. And below that, we have all of the program areas broken out, and you can see the overall percentage of the budget for each of the programs, as well as the dollar figure available for those programs. I'd like to draw your attention down to the call-out box at the bottom right for information regarding the reserve balance and the effect this budget will have on it. We will start the fiscal year 22-23 with a $20 million reserve balance. We will have a carry forward fund balance of $734,000, and we will require a $119,000 reserve release to fully finance a balanced budget for this budget request. So those two items combined is for $853,000, and when you combine that $853,000 in financing with the other revenues of $19.2 million, we come out with the $20 million, which is equal to our budget allocation request. Okay, go ahead and move on briefly to attachment 2, which is the budget detail. And what we'll get out of this is basically an overview of what has changed for this budget request as opposed to what we have in the current budget. And we'll look at these items, we're not going to look at them individually. We'll look at them as an object level, which object 10s are the first group of accounts, and they include salary and benefits. These items altogether have increased over the current fiscal year by $121,000. There's 3 components that basically make up this increase, and that is a higher inflation rate that caused a 4% estimated COLA adjustment or cost of living adjustment. There is also one of the contributing factors is the increased group insurance, our medical insurance for employees, as well as an increase to the retirement contributions. Then we'll have you go down to the next group of accounts, which are our services and supplies. And this group of accounts also includes our direct service contracts, which is the green highlighted row. Our services and supplies have increased by $174,000. The bulk of this is made up from the increase in the contracts, that green row. The increase in contracts was $243,000, and this came from a reduction to the CalWorks by about $1 million and an increase from contracts for ARPA, or American Rescue Plan Act, in about $1.25 million. The reason the net of the services and supplies account is lower than the contract increase is because we have cut costs in other areas, such primarily in our lease space. We negotiated a new lease that cut off about 30% of our square footage, and we're saving about $80,000 a year on that. And finally, I want to cover the revenues at the very bottom. As Beth had reported out, we had taken an in-depth look at our Proposition 10 forecasting, and the ultimate result was that this was increased by about $1 million, and that is shown in these accounts. Okay, let's go ahead and move on to the final attachment, Attachment 3, the 10-year financial plan. Okay, this form is particularly good to look at what kind of resources we have available for the next strategic plan. And it's also good to follow what our reserve balance is going to look like over several years. This form basically contains the prior year, the current year, the budget year, which is the green column, and then 7 forecasted years into the future. The green column, our current, the one we're looking at today, fiscal year 22-23, has all the requested revenues and expenditures filled in. And then if you look 2 columns over, you'll see the next strategic plan period, which is the 2024 strategic plan. And right about in the middle, you'll see the SP reduction, which is stands for strategic plan reduction. And there's good news there. The staff is recommending that there is no reduction for the next 3-year plan. We'll keep it at $14.9 million per year. And then for the 2027 strategic plan, the SP reduction is about 28%. But I would like to remind you, historically, as years go through and we have savings on direct service contracts or we have excess of revenues, we're able to lower the amount of that cut over time. And that's what happens historically. So hopefully that number will go down, and I'll reference the 2024 plan. We used to say that was going to be a 25% cut, and now we are at 0. So hopefully that 2027 will come down some, and it won't be as big of a cut as we're anticipating at this point in time. And then finally, I'd like to take a look at the reserve balance and its effects over the year. If we go back to the green column, we see we're going to start, and this is at the top of the column. We see that we're going to start with a $20 million reserve balance. We have the $734,000 in carryover fund balance, and then we have $119,000 in the reserve release. And we project that we will end the fiscal year with $19.9 million available, or begin the 24-25. I'm sorry, the 23-24 budget year. However, if you just go straight through the years, looking at that year-end reserve balance, and we follow all the way down to fiscal year 29-30, you're going to see that we will end the reserve balance at $3 million, which is the target that we want to keep in the reserve for cash flow issues and any kind of emergency funding issues. And then finally, the last thing I'd like to cover on this document is at the very bottom, the strategic plan has a $14.9 million allocation. However, we're asking for a $20 million budget. So there are obviously some commission actions that were taken that were outside of the strategic planning process, and that includes the CalWorks home visiting program, ARPA, and some minor adjustments made in the contracts within the 2021 strategic planning period. So when those adjustments are added up, it comes to about $5.2 million. You subtract that from our $20 million budget request, and you come up with the $14.9 million approved strategic plan. So with that, I'll conclude my report, and if there's any questions, I'd be happy to address them. Thank you.
Great. Thank you, Eric. Any questions? Commissioner Wirtz?
Just a couple things. One, that was a very clear presentation. And this has nothing to do with you, but I was able to follow it. But your presentation was very clear, so I appreciate that. I tracked that well. And I just wanted to say that the one thing I noted among all these other things was the change in the rental agreement for first 5 staff. One, I know that's a hard thing to do. I was able to go to the site for since these last 2 years, and maybe I'm one of the few commissioners that actually have seen the new site with the new artwork coming up and so on. So I just wanted to say, one, that I think it was a substantial commitment to make a cut in the staffing facilities for First 5. And I think they've done a great job of redesigning the location there. And I think it was a sign, a difficult sign. I know I was pushing for that, saying if our community is having to have cuts, how can we as a commission and the commission staff take the similar kind of things? And I think the staff with Julie's leadership did an incredible job there, and I think the new site looks wonderful, and I appreciate that staff is, in a smaller space and is still able to do this large work. So, we're small but mighty kind of notion there. So thank you so much for that commitment and that sacrifice, and I think it's working well for our community.
Thank you.
Just to follow up on that, I just want to make sure I understand, because I did have a question on the from the detail sheet under lease property. Does that account for the decrease? Well, the decrease compared to the 21-22 final budget for lease property -ACP.
Oh, the ACP? Oh, okay. What's the account number?
It's 20294300. Final budget 21-22 was 186,785.
Yeah, I see that.
And then recommended is 80,000.
Yeah, what you're seeing, the 186,000 was prior to the lease negotiation, but although the lease reduction is applied to this year, we're having about $100,000 in savings this year because we had to use the old allocated budget number. So some of that savings, and this has been reported in the financial committee, has been used to upgrade some technology issues for the conference room, to get laptops because we did downsize. People are working remotely or bringing in to a docking station and sharing space. So there's some additional costs that were going on there. And also we had to do some new wiring, rewire the alarm. These were costs that we absorbed into the savings, but the savings was much more than those costs that you're looking at. So next year you will see a reduction to that ACP cost. It'll come further down probably under 100,000.
Okay, thank you. Commissioner Wagstaff.
Thank you, and thanks for the report, Eric. When I think back on reports you've given before, I think as Commissioner Hassett said, it was nice not to hear about the cliff. I never quickly understood what that cliff was, and now we don't even have to worry about it, sounds like. But as you look at the forecast, and as you look at the budget overall, I guess my question is there anything that you think you need to call to the attention of the commission that we need to watch for, or at least be monitoring, that causes you any concern?
Well, I think the thing that causes me concern is the flavored tobacco ban. It's going to be on the ballot in November. We talked about it in depth in the Financial Planning Committee because we do have projections of the impact that it's going to be. These projections are from the state itself, and it's going to be gradual, but up to a 20% reduction in for our Prop 10 funding. All the reports I looked at outside of the state's report widely varied, but they all concluded by saying we really don't know for sure what's going to happen. So we looked at it and took a kind of a mitigating approach to not the unknown. You know, we don't know if it's going to pass or not pass. So we kind of decided to go middle of the road and take half of the effect of what the state proposed and applied that to reduce those funds. Fortunately, we're already going to be well into strategic planning. We've been committed to a lot of the numbers already. So we've got time to make adjustments to the following strategic plan and work out, you know, the difference there.
Thank you. That's helpful.
Commissioner Wirtz.
Just one follow-up on that. The other area then is the CalWorks and the ARPA pieces, and I assume CalWorks would be possible to think that that might continue more likely. The ARPA, is there any likelihood that you know about the future for that?
No, it's term specific.
Yeah.
It will be ending.
Okay.
Right.
So that will be a cut.
I believe they're both. We have two funding sources there, and I believe they're 2 years and 2.5 years.
Any other questions by commissioners? I did have another question, actually a couple of them. Again, looking at the detail sheet, attachment 2, I think it is. I think this is a question for Julie, but can you remind us, what transpired between last year and this year in terms of media service budget? Why did we go from 33,000 to 56,000?
I'm going to make that be an Eric question.
What you're looking at is the 1 year is the actual expenditures, so we just didn't spend it all, but we still had a $55,000 budget.
Okay.
So it's possible, too, that sometimes those funds get spent in a different account, GL account, that more fits the purchase transaction. And so we'll just make a note under that, because you might see an over expenditure in another account and say, well, this is funded through the media services. So, yeah, what you're looking at there is an actual expenditure compared to a budgeted amount, and you'll see that again in this current fiscal year. We're asking for 56,000 for some reason. It's probably 1,000 that was added for one of the new grants.
Okay. And then employee recognition, $100. What is that?
That's all for Julie. We buy her thing.
I take myself out to lunch with that.
That's just if there's something like somebody's retiring and you want to get them something under, there's a policy, a county policy that has to be followed to make the purchase, but it's just there.
It's not a concern, obviously, with the amount, but I just have never seen a budget line item for that in any of the budgets I've reviewed, and thought it was kind of interesting. So. All right, I think those are all my questions. Madam Clerk, do we have anyone sign up to speak on this?
No, we do not.
Okay, thank you. We do need to take a vote on this, if I'm not mistaken.
Yes.
So at this point, I would entertain a motion. Chair will move it. Is there a second?
Second.
Second by Commissioner Wagstaff. Please vote.
Motion passes. Thank you.
Great, thank you. All right, put my eyes on. Okay, all right, so as I mentioned earlier, we are going to bump item 10 and we'll go to item 11. And this is approval of the 2024 strategic plan decision points for consultant service contracts and the spending plan.
Perfect, thank you. So, as Chair Cerna mentioned, this item has two requests for your consideration. The first is to bring on our strategic planning consultant. So you'll remember at our last meeting in March, the Commission authorized staff to release an RFA to bring on a consultant to help us with this work. They would, under this grant, provide community engagement and facilitation services, as well as produce our final strategic plan document. On March 8th, our commission, the day after the commission meeting, staff did release that RFA because we were on a tight timeline. But we're happy to say that we received two proposals that came through, and we convened a review panel that consisted of myself, two of our advisory committee members, the deputy director of First Five Solano, and the equity lead for the public health department. And we used both a written proposal scoring sheet, and then we held 1 hour interviews with each of the candidates. They came out very close, as you can see from your packet. It was, we couldn't lose with either one, honestly. And we had the best discussion I think I've ever had at a review panel about what we really wanted out of this and the intent of this whole strategic planning process. At the end of a very long discussion, we did end up selecting the SEED Collaborative. We really thought that they had just that slight edge on the racial equity inclusion piece that we were looking for in this strategic plan process. So in your packet, there's an attachment that sort of highlights their qualifications. And so that's one piece that we'll be voting on today. The other piece, switching gears, is the spending plan. So Eric stole a lot of my thunder with the spending plan. But in essence, we do not have a fiscal cliff this time around. And I'm really proud about that. That's wonderful news. And I think a major piece of that is our efforts to bring in alternative money into the Commission for programs and services. And we've used those grants, those non-Proposition 10 dollars, to really offset some of the infrastructure, our own staffing, lease costs, all of those types of things that traditionally have come straight from the allocation. We are now able to build some infrastructure with some of these additional new dollars. So sort of a trifecta going on with, we are able to bring in more money. We also had higher than anticipated revenues. And our agencies, because of COVID, were not actually able to spend out all of their funding, which sort of led us to have an increase in our operating budget and reserve, as Eric was saying. So because of that, we do not, in fact, have a reduction. I made Eric pull some stats for me because I'm proud of this stuff. But In our partnerships, just with DHA, Department of Human Assistance, and First 5 California, we've leveraged $10.8 million in the last 5 years. So in addition to all the Prop 10 dollars. Those grants acquired through those sustainability efforts defrayed $465,000 in internal costs, which was nearly a 30% increase over our current strategic plan going into the next strategic plan period. Through those new alternative revenue sources, we are funding 2 full-time equivalent staff now out of that funding. So when I started, we had 14 staff. We cut down to 12 staff. And now we have only 10 staff covered through Prop 10, but we still have our 12 staff because of being able to pull in those additional dollars. We've also clearly increased our ability to contract and to provide services through contracts. So up from $4.46 million to $4.84 million per year in this new strategic plan with outside dollars, not Prop 10. So a lot to celebrate in this spending plan. Very excited about it. Eric mentioned we will stay at $14.9-ish million per year for a total of $44.6 million invested. The plan is broken down into administrative costs, evaluation, and program costs, and we will remain at the same levels that we are for the current strategic plan. So 7% admin, 3% eval, and 90% program. And just a word on those program costs. We consider program to have internal costs and external costs. So those external costs are all of our contracts that we put out the door. The internal costs include some of the First 5 staffing, our program expenses, the media line item, and all of our expenses related to policy, advocacy, and systems change work. And as the commission has planned with our, fewer dollars that we've been having, and we made that commitment to work on systems, clearly we've been successful and having the staff ability to look at systems work and pull in additional programs to sustain our work. So with that, I am asking for 2 actions to be taken. The first, the contract with the SEED Collaborative, and the second is approval of our spending plan that will let us get really started on the 2024 strategic plan.
Very good. Thank you, Julie.
Yes.
Any questions for our Executive Director? Not seeing any. Madam Clerk, do we have anyone sign up to speak from the public? No, we do not. All right, very good. We do need to take a vote on this, so I'd entertain a motion at this time. Okay. Been moved. Is there a second?
I can second.
Second. Okay. Please vote.
Motion passes.
Very good. Thank you. Thanks again, Julie.
Yes.
All right. Yes, Commissioner Wards.
Just a clarification, that motion covered both components of that, correct?
Correct.
Yeah. Thank you.
Thank you.
All right. Okay, we will now go to item 12. This is the authorization for First 5 Sacramento, our First 5 Sacramento Executive Director to submit a grant application to First 5 California for refugee family support and to execute the grant award notification.
Great. Okay. So this is just one of the 3 items here that has really helped us with our sustainability. So on this one, we don't have it yet, but I'm asking for your permission to apply for the First 5 California Refugee Services RFA. It would be for a 1-year term beginning next fiscal year. And although they had originally discussed a 3-year allocation, They ended up saying, let's do a demonstration in the first year, see what happens, and then see if we'll allocate for the second and third year. And so we can request up to $750,000 for the year. So we're going to go for the top dollar amount because of the number of refugees in our county and the number of service providers who want to be a part of what we're doing. So First Five California in October approved $3 million, and then First Five Sacramento held a listening session on April 20th. We had 15 agencies serving refugee families participate. From the majority were from Sacramento County, but we also had Placer County, Yolo County, and Sutter providers and their First Five executive directors join us for the listening session to sort of get a regional perspective. Those 3 counties are going to apply for a smaller pot of money on their together as a collaborative because they didn't really have at least 50 refugee clients to serve, and that was sort of the bare minimum. So together, they're going to apply. But we did get a pretty good idea about the needs, what's sort of working and where the gaps are. The major gaps were around 3 areas: housing, navigation, and the case management of helping families get to the services that they're eligible for, and then basic needs, which was kind of a surprise to us, but just essential basic needs for people entering the state with young children. So everything from cribs to car seats to diapers to just setting up an environment conducive to young children. So that's probably the gist of where we're going to be going in our proposal. And as I said, our hope is we get funded and that we potentially can get a couple more years out of it, but at least the first year. If we are awarded funds, I would come back to the commission to seek authority to enter into contracts with the agencies that engage with us through our application process. I think I said we had 7 agencies of the 15 did apply or did submit a partner certification form. So we will include that in the application to let First Five California know that we've got these partners who want to join with us in the work. So to conclude, we're recommending that you authorize the executive director to submit a grant application to First Five California for refugee family support to execute the grant award notification and a revenue agreement if we are awarded.
Very good. Thank you, Julie.
Yes.
Any questions for our executive director? Commissioner Wirtz.
Thank you. Just one question, and I'll wait.
Must have.
A question for Julie, unless you have something further to. So just a question of sort of definitions around refugees. Does this include any of the undocumented immigrant community potential as receiving services, or is refugee restricted in some fashion?
It is restricted by there's like a definition. I don't know if I put it in the commission letter or not, but there is a strict definition that First Five California is using around coming through a regular refugee classification. And then there's a time period, I think it's that they had to have come after August 1st of 2021 as well. So it's really sort of focusing on new arrival refugees through the federal refugee program. Yeah, good question, though.
Okay, I don't see any other questions for our executive director. We do need to vote on this, so at this point, I'd entertain a motion.
I'll move approval.
Okay, it's been moved by Commissioner Gordon.
I'll second.
Second by Commissioner Fernandez y Garcia. Please vote.
Motion passes.
Very good, thank you. Okay, I do believe our guest speaker has joined us here in chambers, so we will go back to item 10 and look for our executive director to introduce the item.
Fantastic. I'm going to go up to the podium here, and we do have a PowerPoint for this one. Okay. Yep. Perfect. Thank you. I am just going to, you're going to not have to hear that much from me on this item. I'm really happy to kick it off. This is a discussion item only. And then I will turn it over to Lindsay Dunkel, who is our First Five lead on the 2024 strategic plan. So Commissioner Moak isn't here, but I had a joke at his expense. Anyway, if Commissioner Moak has been around a while, so you know that we've been doing strategic planning since the year 2000. And in fact, the 2024 strategic plan will be our 9th iteration of this roadmap document. And in some ways, it's sort of like we're starting all over. We have a new focus for this strategic plan, and we have a new process for this strategic plan that we've not used before. And I see that the value of thinking of it like it's our first strategic plan, because that gives us that beginner's mindset. That we can all sort of learn. We don't have to be experts in planning. We don't have to be experts in racial equity. We're sort of all on a continuum, and we all are coming at it with our own strengths, and we all have a voice on the commission. And each of you gets a place at the table to talk about this stuff, which is in some ways so much better than just 5 individuals forming a small committee to do the work. So as commissioners, you sit in these seats because you have the trust and the confidence of the community, and that role isn't changing. You'll bring your wisdom to bear, and you'll make the best decisions for children and families. As you know, it's a year-long process, so at each commission meeting, you've been making decisions all along the way. That will continue. You will get to go through and see data altogether, and you'll get to use your personal lens and personal values in interpreting all of that. So I'm really happy that we're starting off our strategic planning discussion with you all at the table, and I'm going to turn it over to Lindsay to walk you through a few slides and introduce our consultant.
Thanks, Julie. So knowing that it can be hard to put on your First Five commissioner hat and remember exactly where you left off, in this case 2 months ago, we thought that we'd rewind the conversation a bit. So how did we get to this place of centering racial equity in our strategic planning? The roots of this can be found in the RAACD work, the Reducing African American Child Deaths, where you really saw the power that your investments could have in addressing disparities when disaggregated data led us to join forces with a whole collaborative of agencies across the county and focus funding on the disproportionate rates of child death in Sacramento, and the outcomes have been truly impressive. And then the next piece was a pandemic that hit, and right away we began to see the disparities, the disproportionate burden of both disease and economic impact of the pandemic on communities of color. And as the pandemic moved toward its first summer, the horrendous murder of George Floyd by law enforcement really jolted the nation around issues of race and racism. And one major reaction was an upwelling of desire to do something to address the problem of racism in our nation. And in response, like many other entities, First Five Sacramento wanted to create a statement about our dedication to achieving racial equity. And you, as a commission, were very clear that a resolution would have to be accompanied by an action plan. And then as we look back at past strategic planning processes, we can see them differently now as we have learned new ways of looking critically at our actions. And we looked at this slide at the last meeting, and as we saw, we recognized many of our practices about how white supremacy culture shows up in strategic planning. We've used our strategic planning to confirm current practice. We've used predetermined focus areas and common strategies. We've had short timelines for starters. So how do we move forward from this? Well, really, we move forward by honing our focus on systems transformation, and what the components of that are for our strategic planning process are becoming more intentional about how we include community voice, looking beyond surveys of just current first 5 program users, looking at disaggregated data, which is exciting to think about this dashboard that's coming forward, and remembering that data belong to the communities that we seek to serve, taking a deep look at how we're allocating resources and how we're selecting funding strategies. So we know that we can't transform systems in one strategic plan, as much as I might like to do that. I keep telling myself the mantra from one Ready workshop that I participated in recently. That is, if you want to go far, go slowly. But we can begin to apply what we know now. So our desired outcomes for the commission are that you increase both your knowledge of the Ready principles and your capacity to make decisions that center those principles, that you allocate resources based on your understanding of racial equity, that you listen to community-voiced desires when you're delineating funding strategies, and that you fund culturally responsive programming and systems change work. So that's where we're heading. We thought we could use a few minutes today to introduce one tool that may be of use to you in your strategic planning work. And to do that, I'm going to hand this over to April Jean of Racial Justice Advocates. And they have been our partners in this work, starting with that internal survey of how First 5 is doing on actualizing our commitment to Ready principles. And the RJA team has been meeting about twice a month with the First 5 SAC Ready team, and we really have cherished the thought partnership. So on to you. And when you get to the slide about your video, it's set to go.
Awesome.
You just have to cue them and they'll play.
Wonderful, wonderful. Good afternoon, commissioners. Thank you,
afternoon.
Julie and Lindsay. Appreciate being here. So just to build a little bit of a container for this conversation, I thought this is really important. As Lindsay mentioned, targeted universalism is the topic that we're going to cover today, but it is just one strategy in the broader continuum of racial justice work. So oftentimes when I do these sorts of presentations, we get caught up in the usage of just one framework, but there's many frameworks, many concepts that we can apply, many definitions that we can apply across the continuum of racial justice work. So just consider this an introductory conversation. You may already have some knowledge of this concept already, but if you don't, and this is an introduction for you, this will be very useful as you all are entering your upcoming strategic planning efforts. So anyway, again, my name is April Jean, Principal Consultant of Racial Justice Advocates, and I'll be talking about targeted universalism today. So as Lindsay mentioned, to answer the question of how do we ensure equal access and opportunity for all, I think that's a really broad question, right? And it's not a question that we're going to be able to answer in the 10 or 15 minutes that I'm going to spend at this podium. However, when we think about a strategy such as targeted universalism, we're thinking about this as an alternative framework to the things that we're currently doing. So alternative to some of the norms and practices that we have instituted. And as Lindsay just covered, many of our concepts and practices and procedures in our decision making are rooted in white supremacy culture. And that is something that we're all trying to deconstruct, right? And so when we think about targeted universalism, racial equity, even equity as frameworks or concepts, each one of these frameworks can be applied to remedy the ills and the wrongs of historical racism. Okay, so this kind of building that container for this. So targeted universalism also is, it's a universal to sensitive structural and cultural dynamics. And so in the ways that it often alludes to both targeted and universal strategies. So you all are familiar with targeted strategies from the RAACD work, right? But targeted universalism wants us to move a little bit beyond just targeted approaches. It wants us to see beyond the individualized disparities that one community might face, but really creating a universal goal for all of us, right? Because in the grand scheme of things, honestly, the African American child deaths, for example, that's just one issue, right? But there are issues across multiple cultures, multiple races, multiple ethnicities. And so how do we really begin to create a universal goal that's going to work for all of us? But then we have targeted strategies that we implement to help achieve those universal goals. So it's kind of an interesting concept, but just follow me here. So the creator of this concept, John Powell, has said that there's a need for us to align ourselves with coherent strategies that begin to create belonging and promote bridging, right? So again, beginning to move us from seeing communities as individualized efforts, but really thinking about us as a broader collective in our social fabric, right? So this approach provides us with the opportunity to really orchestrate more inclusive efforts, and it moves us away from being reactive, passive when it comes to finding solutions for racial disparities, cultural disparities, linguistic disparities, and it promotes the development of intentional, tangible, and thoughtful strategies that center our most marginalized and vulnerable communities. Okay, does that make sense? Just want to give you all a little bit of a baseline there. I think we can move this. I can move the slides, right? Okay. Pardon me, I'm not familiar with doing this in person. I've been doing this behind the screen for like 2 years now. So, which is why I have my handy dandy laptop here. So before I go into a little bit of the deeper context building and container building for targeted universalism, let's watch a quick video and then I'll come back to content.
What is the most effective and sustainable policy response to problems in our society? Universal approaches are widely used in order to package policies for broad appeal. Universal policies such as Social Security and minimum wage laws provide the same benefits or minimum protections to everyone, regardless of status or group membership. But by treating everyone the same, universal approaches can't root out group-based discrimination and may actually deepen inequality between groups rather than reduce it. And by providing benefits or protections to everyone, resources that could be targeted to groups worse off instead flow to those who are better off. In contrast to universalism, targeted approaches are commonly used. Targeted policies provide benefits or protections based on group membership or status. SNAP, the food stamp program, conditions benefits on income level. The Americans with Disabilities Act requires public accessibility for disabled groups, and affirmative action focuses on historically disadvantaged groups. Targeted approaches are vulnerable to the critique that they unfairly favor constituent groups over the public good by directing resources to marginalized groups who are already subjected to unfair stereotypes. But universal and targeted approaches are false choices. There is a third way: targeted universalism. Targeted universalism means setting universal goals that can be achieved through targeted approaches. This approach targets the varying needs of each group while reminding us that we are all part of the same social fabric. This can be accomplished by following these 5 steps. First, set a universal goal. For example, 100% proficiency in 8th grade math. Second, measure how the overall population fares relative to the universal goal. In this example, we might discover that only 80% of 8th graders are proficient in 8th grade math. Third, measure the performance of population segments relative to the universal goal. So although 80% of all 8th graders are proficient, we might find that only 70% of Latinos are proficient. Fourth, understand how structures and other factors support or impede groups' progress toward the universal goal. For our Latino students, classroom instruction materials and lessons designed for English speakers may impede learning, including math proficiency. Finally, implement targeted strategies so that each group can achieve the universal goal based upon their needs and circumstances. This may take the form of ESL-specific math tutoring for our Latino students, while another group may require a completely different strategy to achieve the same universal goal. Targeted universalism rejects a blanket universal, which may be indifferent to the reality that different groups are situated differently relative to the institutions and resources of society. By aspiring towards shared universal goals, targeted universalism empowers targeted strategies capable of achieving those goals, while moving us beyond concerns over disparities alone and toward our highest aspirations for all.
Perfect. Uh-oh. There we go. All right, so again, that is a really short video that covers the concept of targeted universalism, and there's a number of different resources and readings out there to dig a little deeper. And so because that video covers some concepts, I'm not gonna do a lot of like digging into the academic pieces of it, but really wanting to invite you all to walk through a primer that leads into a deeper discussion of how targeted universalism and that mindset will start to integrate into your strategic planning efforts and how that might show up for you all, okay? And so, again, when we think about targeted universalism in context, we're thinking about setting a universal goal with targeted processes, right? So a concept for you all to think about as you're going into your strategic planning efforts is, what is the overall goal for First Five going into your next funding cycle? What are some of the targets that you want to achieve? What are some of the outcomes that you would like to achieve throughout the course of that process? Whether that is resource allocation, how would you like to see the needle being moved forward in our communities as it pertains to certain disparities related to child welfare? So those are some of the things that you all want to start thinking about. And then the targeted strategies begin to materialize through that, right? And so this approach really supports us in thinking about, again, as reminding us that we're all a part of the same social fabric, but we all need something uniquely different, right? So universal, yet it captures how people are uniquely situated, so we can look at the programs that you all operate and that you fund, right? So think about our Birth and Beyond program and the zip codes that we service, right? Each one of those zip codes, I had the fortunate pleasure of working at the North Sacramento Community Center and also at Mutual Assistance Network. And some of the things that we constantly lifted up were that each one of these zip codes required something uniquely different. And then we unpeel that onion back. Each family requires something different, right? So blanket investments, blanket approaches are not going to move us towards a sort of systemic transformation that I think we all want to see, right? And so also thinking about inclusive yet targets who are most marginalized, right? So that's the concept of equity. So looking at this from a perspective of, we really have to disaggregate that data, right, and begin to prioritize the communities that require our investments right away, right? And we have to move expeditiously when it comes to that. And so here we're looking at, again, as I mentioned, there's a number of different frameworks out there, and many of them achieve similar goals, right? But the process for how we get there might look a little bit different. And so when we're thinking about target universalism and equity, there's a question that comes up for me often when I do these sorts of presentations is, what is the difference between the two of these things, right? And so think about targeted universalism as a process and think of equity as an achieved outcome, right? And so targeted universalism creates a goal for us and targeted strategies on how we address the communities that we want to support. And then equity is our desired outcome, right? And so when we think about equity as a desired outcome, we're thinking about if we achieve equity, right? When we achieve it, race, culture, language, socioeconomic class, gender. These things do not determine one's outcomes, right? When those conditions have been set, when we're operating from a perspective of targeted universalism, when we're operating from a perspective of cultural responsiveness, then that means that we're creating the conditions within our environments, within our organizations, to ensure that everyone has what they need to thrive, right? So whether that's internally inside of our organizations, our staff, and that's externally the communities that we serve, right? And so just to give you a little bit of context and framing around this and how we're thinking about targeted universalism as a strategy and a process, and less so as a desired outcome, right? Equity is the desired outcome, okay? And we can do a whole 2-hour session on this, so y'all let me know when you're ready. Okay, so as the video mentioned, universal strategies have historically fallen short. I think we can look at the history of funding in our county, or look at the history of funding across our state, and identify that blanket approaches do not address the unique needs of our communities. In my day job, I am also a director for an initiative called California COVID Justice. And we are really looking at the deeply rooted inequities that COVID has laid bare, and pushing the state legislator to operationalize policies and funding solutions that are targeted to those communities, right? So if we look at disparities for Black, Indigenous, Hispanic communities in reference to COVID, we know that those communities face gross economic challenges. And it just issues in regards to COVID itself, transmission rates, all of those things, loss of life. And so, but the approaches have not been targeted to those communities. And that's why we constantly are seeing those outcomes continuing to propagate or be perpetuated, right? So we're thinking about, from our perspective, if you kind of localize that thought, localize that example, how does that then show up for you all as commissioners? Right? What are some of the outcomes that may not have been achieved because we haven't yet really grasped onto what it means to think about our funding strategies and our resource allocation from a targeted perspective, right? So those are the things that, again, I want you all to really think about. And so to kind of build upon that example, as the video mentioned, universal approaches fall short because they don't recognize the ways in which groups are situated differently. And also a factor that isn't quite named here is history, right? And so I think oftentimes we want to bypass the fact that there are history does play a part in what we see as outcomes in our communities of color, right? And so we can't bypass that when we're creating these solutions. We have to really think about the structures that are in place, the policies that are in place, the conditions that are in place in our communities, and then we have to then unpack how we can begin to remedy those solutions, create remedies and solutions for those disparities. It also fails to recognize the interconnectedness of policy issues, which I know you all probably know a lot about, right? Policy solutions build upon each other, right? And oftentimes we're creating policy solutions to remedy a harm or ill that we've identified, right? But if we don't really get to the root causes of why those ills are continuing to happen, then we're just patchworking policies on top of policies that are often ineffective, okay? And then lastly, the universal is not the strategy or process, but it's the goal, right? So again, that universal goal that we set, that you all set as a commission, and those targeted strategies that you all create to achieve that universal goal, that's the process, right? Or that's the goal, not the process. I apologize. And this also just builds upon why targeted strategies also fall short. I won't go too deeply into detail, but as the video mentioned, targeted strategies and policy stems from the paradigm that says everyone began from equal footing, right? And we know from what we've been learning over the last decade, particularly those that we've all been involved in the RAACD work, that there are various factors that tell us that we did not start from the same footing, right? Whether that's history, whether that's economics, whether that is conditions of our neighborhoods, whether that's access to resources, access to quality education, access to quality healthcare, right? We know that there are conditions that limit folks to having that sort of access. And so again, even though targeted solutions often do work, and we see, kind of the immediacy of the reduction of disparities, what we often don't pay attention to is that the structures and the systems haven't changed. The policies haven't changed. So the time that we move, when we remove the resources away, guess what? The disparities are going to go back up because we haven't addressed the root causes. Okay. It also understands that racism and marginalization is the harm and knocks someone from this initial position, but then tries to restore them to that position. And that's a very complicated and complex statement, but ultimately what that means is that, we understand that racism and marginalization is the harm, right? And that we understand that that is what knocks someone off of someone's path from achieving a said goal or achieving a quality outcome, right? But what's happening is we're putting people right back in the same position, right? We're not, again, addressing those root causes. So that's going to be one of the important things that we begin to look at as a collective is how do we begin to address some of those systemic factors that have propagated the marginalization, right, the disinvestment. And then lastly, the focus must be on transforming society. It's not enough to provide relief to someone who is systemically disadvantaged by the construction of society. The answer is to transform society entirely, right? So that is self-explanatory. And so each one of us in our positions of influence have a responsibility to assure that that transformation is happening. And then lastly, just 5 steps to get us started in this conversation is number 1, just beginning to think about what is that universal goal that First 5 wants to establish for your constituents, right? And again, whether that is resource allocation, outcomes in our communities, reduction in disparities of children going into child welfare, like what is it, right? And you all have the opportunity to determine that. Second, assessing the general population's performance relative to the universal goal. And oftentimes, I think this is super important because we often do a very narrow, broad stroke of a black-white comparison. And what we have to understand is that can't be the rule of thumb, because in many cases, white folks are also not faring well in many of these different factors as well. And so again, just the conditions and the climate of white supremacy culture, we have been conditioned to compare and contrast people of color to the standards of whiteness. And that's something we have to really think about, because we also then leave out white folks, right, when we do that. And so we have to really think about what is happening across the spectrum of the general population in Sacramento County as it pertains to child welfare. And then our answers begin to be illuminated through that, right? So that's a deep kind of analysis of the data that we currently have and that exists in our county. And we can begin to really think about the solutions that are needed, those targeted solutions based on the universal goal that we set. And then third, identify the groups and places that are performing differently with respect to that goal. So I think I just mentioned that, right? Disaggregating the data, identifying what's happening among these groups, and then setting our sights on solutions. And then fourth, assess and understand the structures that support or impede each group or community from achieving the universal goal. So this goes back to looking at those structural factors that might be in place, whether it's access, whether it's barriers that our systems might be creating for individuals. And then fifth, develop and implement targeted strategies for each one of those groups. And that's where the solutions with your role, right, resource allocation, funding solutions, policy solutions. Those are the things that will be needed and necessary for your group. So again, this is just a very short primer. And overall, really the goal for this session, I think, in our conversations leading up to the day, was really to introduce frameworks, concepts, definitions, right? Not for us to be racial justice savants at all. But really as Julie mentioned, to support you all with beginning to build this container for First Five to better understand the meaning of racial equity, diversity, inclusion, and cultural responsiveness, in addition to beginning to establish the tools needed for you all to walk into your ready work and strategic planning, right? And then secondly, the importance of covering this topic is also because it supports you all in building upon your ready work, right? So moving from investigation and conversation to actualization, right? And so ensuring that you all as key decision makers are constantly assessing, and you have the tools to now constantly assess how race, culture, and other intersections impact the experiences of the people that you all support, right, your constituents. And then lastly, it's really important to note that disparities in outcomes are often created and maintained inadvertently by policies. It's also important to note that disparities are often maintained by practices that we don't want to change, right? And so we're then containing the disparities as a body, right? And we don't want to do that anymore. So targeted strategies such as target universalism help to create and curate critical planning questions with an eye towards discerning structural racial impacts. So simple questions such as who's disproportionately affected, who is not represented, right? Who benefits and who doesn't? Those are questions that we could be asking ourselves through strategic planning. And then with that said, so lastly, only strategies that are supported and shaped by considering race, culture as factors are going to be the solutions for us to close racial equity gaps, right? So if we can't think about strategic planning and ready work, right? It has to be an integration, right? And it has to be an integration across First Five's entire ecosystem, and you all are a part of their ecosystem, right? And so that means commissioners, executive leadership team, their advisory bodies, staff, right? So when we're all working on one accord and one baseline, then the solutions begin to be a little bit more accessible than they were before, okay? And so with that said, it was important for us to really think about, as commissioners, you all each have expressed and affirmed the importance of First Five's ready work. This is a really great start. However, now's the time for you all to begin actualizing, right, your affirmations through your collective work. So as you move through strategic planning, it'll be important to begin to think about how this work will show up for you all as a collective and also as individuals. So a question for discussion, and I'm not sure if this made the presentation, so I'm hoping that, nope, it did not. So I'm hoping, if I need to repeat this, I will, but the question that I wanted to pose to you all was, as it pertains to your role, right, as it pertains to policy development, resource allocation, funding solution, what are some of the equity gaps that First Five will need to address during your strategic planning process? That's the first part of the question. And then how might a targeted universalism mindset be utilized to remedy these equity gaps? Okay, so I'll repeat it. So as it pertains to policy development, resource allocation, and funding solution, what are some of the equity gaps that First Five will need to address during this strategic planning cycle? And how might targeted universalism be utilized to help remedy these equity gaps? So I'll give back to you.
Great, thank
Mr.
you.
Serna.
Thank you, April.
Yeah, no problem.
Very well done, and certainly gives us a lot to think about. And I think it's clear that your presentation is not just to help educate us and to do so in public, but to inspire a conversation here today. And so I appreciate that. I want to make sure I kind of understand the concept here.
Absolutely.
Because as someone that has been at the forefront of the RAACD effort and Black Child Legacy campaign initiative, I freely admit that, I personally became educated about the disparity when it was presented in the context of the child death reports that the Board of Supervisors considered over a decade ago, and quickly came to the conclusion that, I guess we'd have to be targeted because this is, by definition, a disparity that is steeped in race in our community. And it seems to me that, and correct me if I'm wrong, but it seems to me that there's kind of this ability to reverse engineer targeted universalism in that, and I'll do it by way of example, when we identified the 4 leading causes of death that were where the disparities most pronounced in the African American childhood population, one of them is sleep-related, infant death. So I believe that because we did target that as one of our objectives to address that particular disparity, that the interventions that we developed and that First Five has taken a great lead on, at the end of the day, are not just benefiting African American families or African American mothers and African American children, but all the above, all the families that we attempt to serve here in Sacramento County. And I think the same could probably be said for deaths associated with perinatal conditions. So it seems to me that by targeting, in some instances, you really present yourselves as an agency or even as an individual an opportunity to take that targeting approach and make it something that kind of by definition applies to a broader population. And it can, I think, address an even broader objective to make all children healthy, to make, all children valued, to have all families, make sure all families have access to resources to accomplish those goals. So is that something that is inherently part of this concept of targeted universalism that I didn't necessarily see in the presentation?
Sure. That's a great question, Chair Senator. And you're absolutely right. I think that just given, I've also been a part of watching the work and the progression of the Black Child Legacy Campaign work here in Sacramento County. And I agree with you wholeheartedly that the targeted strategies definitely have materialized in ways that are supporting other groups in Sacramento County. I think targeted universalism in this presentation, in this concept, kind of speaks about targeted solutions in a different way. And so it's saying that they fall short because oftentimes we limit ourselves to just targeted strategies, right? And so what you're saying is actually a very targeted universalistic approach, right? So that these targeted strategies also are creating a universal goal for the broader community here in Sacramento County, right? Around perinatal conditions and sleep-related deaths. I think we just don't name it that, and oftentimes we're not coming out with those universal solutions. We're still kind of operating from like an old standard of, again, like a black-white sort of comparison of success. But given what is happening, for example, with the BCLC, we're now potentially have the opportunity to create a universal goal for our county, right? Based on the goals, based on the success of that program. And so that's very similar to what we're trying to do and integrate into First Five's thinking, right? So when we see the success of these different groups, how do we then begin to create universal goals for everyone else, right? As opposed to just kind of staying focused on this one group, these singular marginalized groups. Because when we extend those solutions across our broader community, then we see other solutions begin to materialize through that, right? And so I think you're absolutely right. And so no, it didn't cover this in the presentation, of course, but I think what you're saying definitely falls in alignment with the targeted universalism approaches.
Great, thank you.
Yeah, you're welcome.
Any others that would like to comment or share thoughts? Commissioner Wirtz, I see you reaching for your button there. Okay.
Well, I'm willing to wait also, but this is a complex concern by all means. And I just have a few introductory sort of thoughts around this. I mean, one is, I think, a question we have is the First Five has had a mission vision statement for a long time, and I would think that we will revisit that, but I think it is a fairly universal statement at this point. Now, it may not have the targeted component to
That's
it. I mean, I don't have it off the top of my head of stating it as all children will have, be able to reach their full potential kind of notion. So the thing I'm thinking that we need to do to add to the targeted universalism is that we have tried, but I think we need to do more to raise the value of children and families in the scheme of things. When it comes to business, when it comes to how we make financial decisions and so on, children and families are in the mix, but they're not the highest priority. There was a program years ago, over a decade ago in Kansas, called The Number One Question, and it was, what is the effect on children, in essence? And I always thought that was a political policy strategic effort to raise the importance of this issue, so that when we talk about improving children's lives, whether it be for our targeted populations or not, we have more value related to the overall goals. So anyway, that's just one of the thoughts I think. It also may help us identify the policy, systemic, historic infrastructure problems for children. Children have never been the priority. I mean, when we needed them to be out in the fields working, we had them out in the fields working. And when we needed them in school, we put them in school. So that was always more the secondary purpose. So I think one of the things that I'm seeing that we could do, in addition to all of the targeting and so on, is that we need to continue our efforts with our media, with our messaging around the importance of children. And I do think that selling a message in the public is, I worked with Nadine Burke-Harris at the Office of the Surgeon General, and she was very adamant about ensuring the messaging was around all people benefiting. And I think her, and I struggled with that with her, but I think her message there was that we need to convince the public, convince the policymakers, convince the business community that this is a high enough priority that they need to work on for children in general, for example. So I'll just stop with that. But I do think that, one, we're starting with a mission vision statement, and we may just need to continue expanding that kind of concept. So I'll stop with that.
Chair Cerner, may I comment?
Please.
So, Commissioner Wirtz, I think you're absolutely right. And so I just wanted to comment that in the language that First Five has in its mission and vision, the goal of all children is absolutely universal. The thing that you might want to expand upon is, how will all children get there, right? Because that's the question, right? So we certainly want all children to thrive and be successful and have equitable opportunities at success in life. But each one of our groups is going to require a targeted strategy to get there, right? And so that might be something that you want to lift up and name during your strategic planning process, is kind of thinking deeply about the how, right? So how will we achieve equity for all of the children that we serve in Sacramento County by making sure that all of them thrive and are successful?
Great, thank you. Any others? All right. Well, thank you again, April.
Thank you.
And Lindsay, thank you. Appreciate enriching the conversation and getting us, again, to think carefully about how this rightfully fits into our strategic planning process. So I don't believe we need to take any action on this today, but I think it is of great value, so we do appreciate the fact that I believe April had to rush over from the Capitol.
Did.
Yeah, okay. on double duty here, okay. All right, so if I'm not mistaken, we will then pick up with item 13. And this is approval of ARPA revenue agreement with DCFAS and expense contracts with Child Abuse Prevention Center, Applied Survey Research, and Persimmon.
Exactly. I have a quick PowerPoint just to give you the highlights. Okay. So yes, today I'm asking for approval to accept the ARPA funding in order to implement a new program called Building Strong Families. Oops, I forgot my PowerPoint thing. Hold on. Okay. And as you said, this would bring in $2.2 million to execute an agreement with DCFAS. That brings the money into us. And then it would be a $1.8 million contract with CAPC, who would be fiscal agent to Birth and Beyond Collaborative. And I did want to note that Commissioner Wagstaff did recuse himself for this item. And then also seeking approval to execute contract amendments with both ASR for $50,000 and Persimmon for up to $25,000 to support the evaluation services. So Building Strong Families is a collaborative program of DCFAS and First Five. Back in January, the Board of Supervisors allocated $3.9 million from the ARPA funding for this program, and it will enhance child and family well-being through an expansion of our Birth and Beyond and Black Child Legacy campaign programs, which are successful programs already up and running and making a difference in their communities, those communities that were hardest hit by COVID. DCFAS is going to contract with Black Child Legacy Campaign Sierra Health Foundation, while we contract with CAPC. And the project would fund 15 navigators. These are family support navigators that would connect parents and children to critical services, with the goal of supporting and building strong families in those geographic neighborhoods hardest hit by COVID. The group, we envision them as working together as a cohort, so all 15 being trained together, really doing the work together in partnership. To ensure adequate staffing, we are sort of requiring that each site have a full-time navigator funded through the program, and each FRC and community incubator lead would receive $225,000 over the 30-month period. The navigators, as I mentioned, would work as a cohort. Our goal is to reduce stress in these communities, lift families out of isolation, and connect the parents and children to those vital services. They will also be following up with the families to make sure that their referrals actually resulted in families connecting to services. The navigators will track outcomes, conduct follow-up assessments. They will use a closed-loop referral system, so we're giving them two options. One is Persimmon is being built out to be a closed-loop referral system. They can also use Unite Us, which is a platform that the ACES network of care is using, and others are, many of our providers are already up and running on Unite Us. So they'll have two options. We're going to figure out how to collect it from both, but that really allows the navigators to see exactly when their family connected to a service and what happened as a result. We are contracting with ASR to build a results-based accountability evaluation framework and the tools that would be used for the case management and navigation services. And we'll have an evaluation plan that is tracked in Persimmon. So that's it. It's pretty quick. We have already begun meeting with the collaborative partners. I believe that this item is going in June back to the board so that They have authority at DCFAS, and we just don't meet again till August, so I wanted to get a jump start on it and get your approval in advance. So assuming everything goes well at that board meeting, we can really launch on July 1. And that concludes my presentation.
Great, thank you, Julie.
Yes.
Commissioner Hassett.
So this is a new position at each of these sites, right?
Correct.
So how will is it filling in perceived gaps? How will it work with the existing programs that are already happening in those locations?
Yep. So a couple of the FRCs do have a navigator that's funded under our specific RAACD work, but not every FRC has a navigator on site. And the community incubator leads, they have staff, but there's nothing called like a navigator on site. So we see it as filling the gaps that their families are eligible for so many services and are not getting to them. It's just the exact same message when we did the community listening session with the refugee service agencies, and we asked them, do you need money for direct services for these things, or do you need people to help your families get to the services that already exist? And 100% they said, we need people, we need case managers, we need bilingual, bicultural, we need people that can help our families get there. And I think that's the same thing that's happening at the FRCs and CILs, is especially with all this new ARPA money that's coming down and new services are available, just having a trained cohort to be able to get the families to those services came out as a need. Yeah.
Commissioner Fernandez y Garcia.
Yeah, I can attest to the need for that, actually, as a community provider, how difficult it is for me to navigate referring people to different services. And when I communicate with CILs or FRCs, I can certainly hand off the case, but they also communicate back how difficult it is for them to engage with those different services. So as a person who works in clinics where we refer a lot of patients to the places that we're funding,
yep,
to have a cohort of people who are working together and have the whole lay of the land of services for this community would be fantastic. So I applaud this effort, and if I can put in a plug that cohort of people think about a centralized way to receive referrals, communicate with each other, communicate back to providers, it could be a very, very powerful tool for these families and these communities.
Absolutely. The only closed loop referral system we have right now is Help Me Grow. And so we really do we see that need for the provider, the person making the referral, to know what happened to their family. That's one of the reasons that Unitas was actually created. It's funded by Kaiser and Blue Shield, and it was really so that medical providers could find out what happens when they make referrals out to community. But we're slowly trying to bring our contractors on, and we've given them Persimmon as a backup for those who don't want to go there yet.
Great, thank you. Commissioner Wirtz.
Yes, I certainly applaud this approach as well. So my comments are not about about any downside of the program itself. Obviously, well needed and will be quite helpful. I guess my question is the broader one around our strategic planning and our strategic thinking, actually, that will these new navigators be sort of able to focus on the systemic barriers that we're fighting around about making these referrals and why we're making them and so on. So I guess it's really about, does this only really focus on program and individuals, or is there a systemic component besides improving, the communication and the process of the programming? But I'm just thinking of our broader discussion we just had and the need to change the systems that we have in the public health, the old downstream notion, if we can keep just getting better at pulling people out of the water, that's one thing. But if we is this program, are these navigators going to be given the authority to be looking for where those barriers and making recommendations around the systems that need to change to make for less of a need for those barriers to be there in the first place?
That's an excellent question that I'm going to turn into a suggestion to bring back to our planning group on. I do think that makes great sense. And who better to do that than the folks who are out there working it and see what those barriers are that are holding the families back from successfully navigating those systems and getting what they need. So that's absolutely something that I can bring to our group. It's just a joy. Can I say it's a joy to be able to build a program with the providers in the room and talking with each other. We've had a couple of large group virtual right now meetings, but as we figure out what this program should look like and to not just be a funder up here saying this is what you shall do, and we might not be the best to say that, but to be able to have those conversations. So this is definitely something I'll bring back and put on the table.
And just one small follow-up to that. I think the navigators are often not in a position to necessarily even recognize what the systems barrier is. They may, and they need to have their voice in that. But I think the collaborative that you're just mentioning, the forum, the table at which the partners work is a place where if you're paying attention to that, you can then potentially identify that, well, if we just work to change the Medi-Cal rule on X or whatever it might be. So it's not just the navigators that can identify and recognize the solutions there, but rather the whole system partners that you're working with.
And in some ways, just having those two systems, if you look at Birth and Beyond as a system and Black Child Legacy as a system together in the same room, really hashing out a joint program together for the first time, it's like we're making history in that way too. Yeah.
Okay, great, thank you. Any other questions or comments from commissioners? I don't see anyone. Madam Clerk, do we have anyone from the public sign up to address this item?
No, we do not.
All right, very good. We do need to take a vote, so I'd entertain a motion at this time.
Go ahead, please.
I'll move the item.
Okay, it's been moved by Commissioner Gordon.
I'll second.
Second by Commissioner Wirtz. Please vote.
Bruce is recused. Okay. Motion passes.
Great, thank you. Mr. Heyer, for the record, Mr. Wagstaff had to recuse himself on that item?
He did recuse himself on that one because of his oversight of DHA, and I believe that also holds true for the next item, item 14.
Okay, very good, thank you. All right, item 14 is approval of the CalWorks Home Visiting Revenue Agreement with DHA and the expense contract with the Child Abuse Prevention Center.
Okay. For this one, asking authority to enter into a revenue agreement with DHA for $4.7-ish million for the CalWorks Home Visiting Program and the expenditure agreement with Child Abuse Prevention Council for $4.45 million. This would allow for the continuation of our CalWorks Home Visiting Program. We call it the Family Support Initiative. We did see, if you'll remember from Eric's presentation, we had a $1.3 million reduction in the current year, but it actually turned out okay because we don't think they're going to spend all of their allocation still. They're still ramping back up in CalWorks. So this allocation takes us back to the original allocation that has fully funded for $4.68 million. It also provides some of that infrastructure that I was talking about. We have some admin and program staff that are covered by this. The home visiting program, specifically two evidence-based models. It's the Parents as Teachers and Healthy Families America funding. DHA is scheduled to go before the board on June 7th, so we had to kind of get ahead of it again so that we didn't have a lapse beginning in July. So assuming everything goes well at the Board of Supervisors accepting the money from CDSS, then we would be set to go for July 1 through June 30th, 2023. And I'm happy to answer any questions, but it's a pretty straightforward one.
Okay, very good. Thank you, Julie. Commissioner Wirtz.
Sorry to keep having questions, but I think this is just more of a general comment that, Julie, you know from our work on the evaluation committee, that one of the question marks on targeting these services to families to be successful is making good assessments at the start of what the level of risk or level of concern is for supporting families. And that's not a home visitor decision in itself. It's not the Child Protection Center issue by itself. It's really working between DHS and child welfare system itself in making those. And I guess I'm just wanting to remind us that that is one of the biggest issues of success, is whether we can engage families at the highest risk. And that's where we tend to have the most difficulty, of course, because there's all kinds of reasons for access and concerns and so on. So more to alert us to continue focusing on that assessment process and mechanisms to better engage those highest risk families. Not an easy task, but if we just end up saying, how are we doing with the families we reach, we limit our ability to truly stop some of the damage that might be happening to families and children. So just a heads up for this program as well, because we know we have those concerns with the Birth and Beyond program and so on.
Thank you. Well taken. Point well taken.
Great, thank you. Any other questions or comments for Julie? All right, Madam Clerk, do we have anyone from the public that is eager to address the commission on this item?
Not today.
Okay, very good. Then I would entertain a motion at this point.
I also move if...
Okay, it's been moved by Commissioner Wirtz. Is there a second? And seconded by Commissioner Fernandez y Garcia. Please vote.
All right. There we go. Motion passes.
Very good. I'd invite Commissioner Wagstaff to rejoin us if he so chooses. Assume he can hear us. There he is. All right. Next on our agenda, this is the...
Sorry to keep you out.
Well, it says public hearing here. It says no vote, though. Is it a vote or not?
We just have to hear from the public
Okay.
on this item.
Okay.
We don't have to accept it.
This is the First Five California Annual Report for 2021.
Correct. And this we have to do each year to remain in compliance with the Prop 10 statute, which is we have to give the public the opportunity to make comment on the First Five California Annual Report. This is the 2020 to 2021 Annual Report included in your packet. And it covers their direct services, fiscal, and systems improvement work, which is partially their work and partially the work of all the counties, because we put in all of our data and it all gets compiled into this report. The total expenditures in their three primary areas were $280 million over this fiscal year, which was a 12% reduction from the prior year. And I think likely in the way that we had a lot of cost savings as a result of COVID and not being able to provide direct services. We clearly were not the only county who experienced that. And so we had 12% fewer expenditures. And however, though, there was $103 million spent in the improving systems of care for children and families, and that was an 18% increase. So kind of like we started focusing on systems work and our ready work, I think that's something that happened across the state as well. So we saw increase in direct services, or decrease in direct services, increase in systems work. Highlights of the programs and services provided by each of the county commissions can be found on pages 35 34 through 57. Our information is on page 47. And unlike some of the other counties who throw in a little bit of everything, we just usually pick one thing that we're going to focus on, and we focused on our Help Me Grow special study this time around. And that concludes my report.
Okay, great, thank you. Any commissioners have questions or comments? Commissioner Wirtz.
I did want to just highlight, there's a ton of stuff that the state is doing that is, I mean, it's a valuable report, and there's lots of things in there. So I'm only highlighting this because of my own reason to try to focus on systemic issues. But so I just wanted to highlight that one of the things that First Five California has been doing is supporting the legislation that implemented universal income supports. And the California Department of Social Services then developed this foster children and pregnant women focused universal income support program. And I mentioned it to the commission and to county staff that Sacramento County could potentially apply for that. We know part of it's not First Five if it's the foster kids aging out of the system, but it also focuses on pregnant moms. And I'm not sure whether whether we're going to be able to fit that or not. But the reason I highlight it is that when we talk about systems change, just think of the foster kids and the incredibly difficult challenges they have, and therefore the sort of the negative consequences disproportionately that they have. They become parents soon, and so on. So if we don't change the structure, the infrastructure, the support systems for kids and families to develop, we can continue to provide services, and that will help, and we can be successful around that, but we won't make the long-term systemic changes to support our families the way we would like. So that's just an example of a systems approach that isn't your typical programmatic effort. And it's been shown time and again and it goes against all the myths that we have around if you give people money, they're just going to go out and buy beer and whatever, candy. It turns out that what people do when they're given necessary basic needs support with money, they spend it on what you and I spend. I mean, I buy candy also, but I don't buy it I buy what I need in terms of keeping my family well. So just want to highlight that as a kind of intervention that fits into our systemic approach that doesn't fit the typical model that we look at programmatically. So thank you.
Thank you, Commissioner Wirtz. Any other questions or comments by commissioners? All right, if not, I know that we do have to have a public hearing on this item, so we'll open the public hearing. Madam Clerk, do we have anyone signed up to speak on this?
No, we do not.
I will then close the public hearing and thank our executive director for her report. All right, we're near the end of our commission meeting, and this is the commission members' opportunity to address the commission on anything that might be on their minds. This is a first, Commissioner Wirtz. Yeah, maybe you didn't have enough candy or something. I'm not sure. All right. With that, then, if there is no further business before this commission, I want to thank staff for all their work to prepare for today's commission meeting, and again, just say how wonderful it is to see everyone in person finally. So with that, we are adjourned.